Good afternoon, everyone. Welcome to the facility. My name is Tanya Londono-Rivera, and I am going to be introducing you an interesting topic. Today, it's going to be an accounting topic. It's going to be mainly about opening an account. For instance, if we open a new facility, it could be in our case, the project will be based on a family practice care, which would be we're going to a different country. We're going to open a new business in that place. What will we need? There are going to be six different perspectives that any facility should be. First would be a patron. Who will be the patron? Who would be in charge? In order for any medical practice or any facility to be open, there has to be a medical practice, there has to be a medical director, there has to be a medical. So all these different terms rely on each. One, for instance, would be a medical director, perhaps Jaco, who would be the ones coming supervising the facility, making sure everything's okay. You pass the rules. You obey the rules. Everything's nice and sanitized. There's no way. There's no things that they need to close down the system, which is very, very, very highly maintenance. So we're going to talk about this. According to our PowerPoint, we will say our first slide consists of the accounting. There are many perspectives. There are many perspectives. Within this would be six perspectives. What does the six P's mean? We have six P's for any facility to function. The six P's, as I was saying, the patron. In this project, the medical director, Jacob, would be the ones willing to fund the project, which in this case means they would be the ones able to compare similarities and differences in the previous company or clinic. Our next P is population. The population is in which affects the rest of the employees on payment rates, on if the population doesn't have the same interests, where do we land? Where are we near? For instance, if we have a high volume of patients in the facility and we have a low amount of employees within the facility, it would match out great. If we have a huge high amount of employees and a small population of patients, then our economy or the payments and interest will go very low because we wouldn't have enough to cover expenses, enough to cover inventories, enough to cover anything that we need within the facility to overcome. Another one would be we have to find problems. For any facility, we have to see any problems going on so we can help. So what as a medical director, I could help, or as a medical one in charge, I could help, which would be the main problems would be addressed, which would be finding out if one of a company covers the enrollment and payment of employee. Do we have enough to hire employees? Do we have enough to not hire employees? Do we have enough to cover the expenses, or do we have enough to not cover expenses? Is the company beneficial? So if it is, can we make an affordable profit, or is it profitable? Yes or no? What would be the significance of the company in another country? If we're in the United States of America and we decide to open a country outside, for instance, in South America, for instance, where I'm from, Ecuador, I have to make sure it has the capacity, the ability to not just accept insurance. Remember, it's a different country. We come to different scenarios. Every state has different policies, has different insurance, has different care. We have to investigate. We have to try to find a solution to make all these problems perfect. Another one would be paradigm, which would be a protocol in conducting the company, the clinic, and providing rules for employees to obey and follow, which would be HIPAA, OSHA. We have to make sure it's in science all over the practice, all over the clinic. We want to make sure everything's nice and clean, nice and organized, and employees are available to follow the rules, follow the protocols for anything, usage of machine, usage of laboratory. Make sure you wear gloves. Make sure you at all times when you're dealing with patients or checking a glucose or you're doing A1C, or you're providing a EKG, or even a diabetic foot exam, you want to make sure you sanitize all the time, before, after, gloves, after. What does it mean? Cross contamination. You want to make sure you don't have any type of, you know, you don't want to produce any illnesses. What you want to do is cure illnesses. So these are important rules in any family practice, in any facility, that need to be obeyed and followed directions. Specifically when you're checking specific machines in the laboratory. For example, I would say in this case, the facility we will have is a family practice, which means family practice can be from the infant children's, all the way to elderly. What it means, everybody has different care for. Infants, we want to make sure we're accessible to do physical exams, to do heights, to do weights, to do, eye exams, to do all these types of, physical, clinical administration on them, which would make it easier for the provider or the doctor to see them, which would be in this case organizing all the papers that needs to be signed by a doctor or by a PCP, making sure everything is nice and organized and clean, accessible for you, accessible for the clinic, making it easier for the patient and easier for us. Making sure this company has set standard obligations and requirements, which set would be here. As an employee, you are required to have a 30-minute break, non-paid, which means you punch out, you go sit down for 30 minutes and you punch back in and you start working. Why? Every practice is different. Our practice is going to be 8 hours. You come in from 8, you leave at 4:30, but you're paid for 8 hours, which is 8 to 4, depending if you do night shifts. So these are different standards that I highly recommend for any practice, any facility. And it just, makes it even easier, clean, a beautiful atmosphere. You just want to continue staying, which is, it's phenomenal. I highly recommend, I highly guarantee, and I think the new clinic would be a good option, making sure we have the right requisites. A plan. We can't do anything without a plan. We have to plan everything out, plan every little corner of a place or facility. For in this case, will be a family practice. Is the new business pretty much following the same protocols as the previous business? Is it is this business more than or different? What does it have? What are differences and what are similarities? Organization, calculation their budget for it to not be short, which would be calculating inventories when we're using on patients, when we're providing, for instance, pap smears, when females coming to do OBGYN, making sure they have every five, if it's normal, every 5 year pap smear, which we have to have instruments, tools. These tools go by fast. We want to make sure we have the enough tools for the next patient if the next patient needs it, which makes it easier. And I highly suggest a fit plan. Without plans, I don't think any facility would be officially open. Every facility has to have their own plan to make organization, to keep clean, to keep organized, to make it feel, wow, a clinic is all set. A clinic it can have its, different differentials, which means one practice has more people, another practice has different type of people, or insurance based. Since it's the same practice, insurance should be typically the same. If it's a different country, they might have different similarities, which will make it a little different. I highly recommend opening a practice, a family practice. We need more family practices in this place. We have a lot of ill people. It can be from children, from child, to people who are undocumented. So I highly recommend a new facility in a different country elsewhere, South America. A lot of undocumented people who are patients as well and need care for an American company or an American practice in a facility that does not speak English, that does not, is even more beneficial because you're bringing more people, having the assurance that you're going to be taking care of them. You're going to provide care. You're going to provide, all the assistance as we can do to just care. That's very important. Lastly, bluntly, the price. We want to make sure the budget is limited, following the protocol, making sure it's not just beyond and expected in pricing, which means, can we afford the clinic? Can we afford Can we afford? If not, we have to make different arrangements, whereas we can and whereas we not. Alrighty, we have come to an end with this fabulous topic. I would like to suggest and highly recommend, if anyone's willing to open a practice elsewhere, always follow these 6 P's, which will very much help. It was a pleasure, class. You have a wonderful rest of your day. Enjoy. We'll keep you posted. I will keep you posted in anything and any more information. It was wonderful talking to you. You have a wonderful rest of your day. If any questions or concerns, you're more than welcome to email me at tlondono at cw.edu, which is our current college email. Have a wonderful rest of your day. Take good care.